Hello, my name is Sigfusson and I'm the chairman of Planet Youth. I would like to introduce to you one of the workshops of the Planet Youth Academy or the Planet Youth Guidance Program. We currently have 5 workshops available. The first one is about coalition building. The second one, which we will introduce now, is the general introduction to Planet Youth and the preparation for the data collection. The third workshop is about the results and review and dissemination of Planet Youth and planning. The fourth is about the goal setting or the municipalities for the local teams and action. And the fifth is the community implementation of Planet Youth in the local setting. So I'm going to give you a general introduction to Planet Youth. We like to call ourselves a family, and we welcome you to the Planet Youth family. So, what is Planet Youth? It's a population-wide primary prevention process or methodology designed to have a long-term impact in communities and reducing substance use amongst youth and adolescents. And instead of constantly handling and discussing facts and faults of substance use, alcohol, tobacco, and other drugs, Planet Youth focuses on treating society as the patient, the environment of the young people as the patient. Planet Youth believes that building an environment that delays the onset of substance use as long as possible is an effective approach to reducing long-term health problems related to youth substance use. Planet Youth has been working with municipalities, schools, community, and youth-serving organizations and sports clubs to change the environment of our children so that they will be in lesser risk of substance use. So it's all about building action on data, using knowledge to build a better future for children. So why is data so important? Data allows community stakeholders to understand the situation in the community, to take informed actions, to increase protective factors and decrease risk factors, and ultimately change the environment of children and youth. And how are the schools involved? Planet Youth uses school surveys to gather the necessary information from the youth. The foundation of this approach is the information that students provide us with through the school surveys. This information allows us to assess the risk and preventive factors in the environment of adolescents. The schools are the source of information about the environment. By completing a survey of 60 to 70 questions, students can share information about several important factors in their lives. This takes about 1 class hour or around 40 minutes. Within 8 weeks of the data collection, reports are created and delivered to both the municipality and the individual schools. Our reports are very visible. After the data collection, within 6 or 8 weeks, the municipality gets a report about the actual situation in the local setting. And each school also gets a special school report. And these reports are confidential, and the schools decide what to do with them. But in the school setting, you can decide if something needs to be changed or what you want to work with. And then also we have information that can be delivered directly to parents. They're all very visual, and there is no mumbo-jumbo, long sentences, scientific texts, or big tables of numbers, but full reports of very visual infographics. Upstream thinking, a social innovation. Instead of constantly pulling children from the water below the waterfall, Planet Youth walks upstream and builds fences so children do not fall in. Our focus is on primary prevention. So primary prevention is preventing the development of substance use before it starts. Secondary prevention refers to measures that detect substance use, and tertiary prevention efforts that focus on people already abusing substances. So it's all about understanding the risk and protective factors in the lives of adolescents. Risk factors are the ones in the life of young children and adolescents that increase the likelihood of substance use. Preventive factors in the life of young children and adolescents are the ones that decrease the likelihood of substance use. And I'd like to show you a picture taken downtown Reykjavik, the capital of Iceland. This is in 1997 or 1998. It was in the middle of the night. There is daylight at the time in Iceland. And the city center was full of young people, and far too many of them were using substances. And in 1997, 1998, Iceland scored among the highest in substance use amongst European adolescents. So the situation was grave, it was serious, and we needed to do something. And when I say we, I have to emphasize this. It's all the people working on prevention in Iceland. Parents, schools, education, health, police, church, practitioners, politicians, everybody related with children. I will say again, what we had been doing was trying to teach kids how to take responsibility for their own well-being, making them responsible for how they would succeed in life. To do this and do not do that, and in our case, this methodology was simply not working. Children were never asked about their lives or their environment. This picture of kids in the 10th grade is from the 90s. They were never asked about well-being, substance use, family circumstances, leisure activities, or risk behavior. In 2017, an article about the work in Iceland was published, and this was the title: Iceland knows how to stop teenage substance use, but the rest of the world is not listening. And that article simply went viral across the world, totally out of control, and we didn't know anything about it. But suddenly the phone started ringing, emails pouring in, and we were asked if we could inform about the work and show others what had been done in Iceland. So basically what we're doing is we are telling you a story, what was done in Iceland. And let's look at what the Icelandic prevention model is all about. We found that there are mainly 4 domains that need to be addressed to change the environment. It's the family factors, the peer group factors, school factors, and the leisure activities. And what we could see from the data was that young people, children who reported that they were spending much time with their parents, got support from home, and the parents were monitoring where the children were and who they were with. Those who said that it was easy to get caring and warmth at home, we could see that these children were less likely to start using substances. And that we could inform the parents about. And when I say we, I'd like to emphasize, it's all the people working on prevention in our country. Everyone. We've also seen that the peer group effect could be positive and negative. For example, we could see children who reported that they were hanging outside late at night with friends, doing nothing, were more likely to start using substances. The school factors are hugely important, and it goes without saying that children who report that they feel well at school, they're less likely to start using substances. Those who, on the other hand, report that they feel bad, being bullied, and the circumstances at school make them feel bad, these are more likely to start using substances. And young people who reported participating in activities, it could be sports or arts or whatever, in an organized manner, 3 or 4 or 5 times a week, in an organized environment, they were less likely to start using substances. But an essential factor is that what we later saw, that the organized activity must also be of a high quality. It really matters that the teachers and trainers are people that know what they're doing and that they're good role models for our young people. And this is what everybody wants to achieve. This graph shows in 1998 that 42% of our 15 and 16-year-olds had become drunk in the past 30 days. Now this is down to around 5%. 23% were smoking daily. That's gone. However, new things are popping up vaping, nicotine pads. So there are always new challenges, and we always have to be on guard. In 1998, 17% of our 15 and 16-year-olds had tried cannabis, and that's now down to 7%. And I'd like to give you some examples of the actions taken based on the findings. We're, of course, constantly focusing on informing parents about how they can be the biggest preventive factor in the lives of children. And the information needs to be given to parents, not only of those who have children finishing school, but also to those who are starting school. And let me show you a few actions. On the neighborhood level, we had the so-called parental prowl, where parents gather on a Friday night, Saturday night at the school, and they walk around the neighborhood just to find out if somebody is in a problem, somebody needs help or assistance to get home or something like that. It's not policing, it's simply to be there as parents if somebody needs help. On the community level, we have the so-called leisure cards. And this is where communities support parents financially so that all children have the possibility to participate in organized, quality-controlled activities of their own choice. And on the national level, there were all sorts of campaigns, media campaigns aimed at changing the way people think about substances, for example. As I said before, we can inform parents about how their support, caring and warmth is hugely important, and that parents listen and discuss with their children also about personal matters. Advise and discuss about the studies is important. And as I said before, children who report that parents know where they are in the evening and with whom are less likely to start using substances. And of course, when we looked at the peer effect, we saw that the outside hours were something that needed to be addressed, and we need to encourage parents to have their children come home, not too late at night, because hanging out late is a risk factor. So many guidelines like these are given out to parents from schools and from the community. We have an NGO called Home and School, which created the so-called parental agreement. The parental agreement is an agreement between the parents and the children on how the parents promise that they will behave to be the biggest preventive factor in the life of the children. We also have an NGO called the Together Group, which constantly focuses on reminding parents about the importance of spending time with their children. At the end of the school, for example, in May and June, parents are reminded that school is over and they need to be aware that the children cannot just be outside alone and do nothing for the whole summer. They need to do something. So all these things are playing together. Some parents assume that it is better that they give alcohol to their children instead of their children getting alcohol somewhere else. But when you do that, give children alcohol, you are basically accepting to your child that it is okay with you that your child uses alcohol. So this is one of the campaigns that was several years ago by an institution of public health. Is your father the dealer? So trying to direct responsibility towards the parents, because no child, of course, should be using alcohol or substances of any kind. Today we know the effect that alcohol has on the brain, and that children who are starting to use alcohol before the age of 15 are around 4 times more likely to become dependent on alcohol later in life. And no parent wants to be a part of that. This is an example of the parental agreement on basically the standard rules and guidelines. What is allowed and what is acceptable and what is not. This is in the schools and acts towards strengthening parent-school collaboration. The parental consensus is divided up into 3-year spans, from 1st to 4th class, and between 5th and 7th, and finally from the 8th to the 10th class with increased or different responsibilities. Our friends in Ireland have created the so-called parental guidelines based on the same findings as we had in Iceland. So in this way, we are seeing different initiatives being demonstrated in different countries, but always with the same aims and means. And there are a lot of other things being done to affect the environment in which our children grow up in. We have clear rules about school events and activities in the youth centers. we've been able to change the culture within the leisure activities, be it sports, arts, or something else. There are regular meetings with parents in the schools and in the leisure activity centers, all about increasing the number of parent-supervised activities that include the children. One thing which is also being adapted in other countries is the Prevention Day. This day is held in the schools and emphasizes the importance of parents spending time with their children, participation in organized activities, and to delay the onset of alcohol. It is so important to send clear messages to parents. Here is an example of messages being delivered regularly. Encourage participation of children in leisure activities. Take an active part in your child's education and school. Monitor your children. Know where they are and with whom. Spend time with your children. Be together. Don't buy alcohol for your children or teenagers. Don't send your child unattended to summer festivals, for example. Go along with your child to sports events, concerts, or other gatherings, and follow the outside hours rules for your children. Now, how is it to work with Planet Youth? So we engage with communities, municipalities, or local areas for 5 years. We require that this is a 5-year agreement because nothing happens overnight. And it takes time to start changing things. So the first year is about coalition building and collecting data, taking a look at the real situation, making strategies and actions. In year 2, the normally is not a data collection, but emphasis on action and follow-up evaluations. And then in year 3, another data collection, and so it goes on and on, data collections and actions every year. And just a few examples of our role in this collaboration. We advise on coalition building. We provide training in collaborative substance use prevention. We prepare and assist in the data collection processes. We provide training on how to present and use the findings on the local level. We take care of data analysis and reports. We advise on designing and executing dissemination and action plans. We advise in developing interventions and strategies. We advise on community development. We provide support to our partners. And we constantly evaluate the processes. To emphasize, there is no magic in Planet Youth. It's a constant collaboration that is structured over a period of 5 years. And Planet Youth works according to these 5 guiding principles of the guidance program. The first guidance principle is to apply a primary prevention approach. The second is to emphasize the community action. The third is to engage and empower the community members. The fourth is to integrate researchers, policymakers, practitioners, and the community members. And the fifth is to match the scope of the solution to the scope of the problem. Far too often we have seen even governments throw a lot of money in one direction without knowing if it is working. But with Planet Youth, you know where to invest. And just briefly about the 10 course steps of the model. Planet Youth is a well-structured methodology, and we work in the same way with all our partners. The first step is the local coalition building, and we guide you through that process. The second step is securing the local funding, which needs to be for over a period of 5 years. After that, the third step is to prepare for the first data collection and community engagement. Step 4 is the actual data collection and processing. Step 5 is enhancing the community participation. Dissemination of findings comes next. Step 7 and 8 is getting the community goals and align the policy and practice on the local level. Step 9 is the activities themselves, and step 10 is basically to repeat steps 1 to 10 over and over again. And finally, a reminder about the core elements of Planet Youth. Planet Youth is evidence-based. We must know where we are going. We have to know where we stand based on data. That's the community approach about changing the social circumstances of young people and influencing their behavior. And we need to align research, policy, and practice to create and maintain a dialogue between researchers, policymakers, and practitioners. So Planet Youth is not a project. A project has a beginning and an end. Planet Youth is a methodology. It's about changing the way we think and then acting in a different way from what we have done before. We like to emphasize, we don't change things overnight. This takes time. Thank you very much, and we look forward to seeing you in the Planet Youth family.